Now let's turn to Davos, where the issue of mental health features high on the agenda of the ongoing World Economic Forum. Now, Prince William has been attending a panel discussion called Mental Health Matters. The Duke of Cambridge has long been campaigning for mental health issues and says the world's major employers, many of whom will be represented at Davos, will have a vital role to play in promoting healthy societies and workplaces. Let's head to Davos now and talk to Nancy Brown, CEO of the American Heart Association, who's been joining with those discussions. Welcome here to the programme. Is this the first time that mental health has been discussed there at Davos? How big an issue is it in your view?
Mental health is a tremendous issue that will face all of us in the global markets. And it's had a presence in Davos in the past, but this year has really been a signature year for us to highlight the critical importance of mental health and mental health disorders and how they impact our societies.
We heard Prince William trying to raise some of the key issues. In your view, what are the biggest gaps in provision?
I think the biggest gaps are an understanding and awareness that all of us have mental health just like we have physical health. And when we think about our employers as an example and individuals that go to work every single day, people are bringing burdens with them to work. Although our employers don't often understand the level or the extent to which employees are facing challenges around depression, anxiety, substance abuse of themselves or their family members, suicide of family members. These are real issues that are underreported, under-discussed, and there's a real stigma for individuals who face these mental health disorders either periodically or on an ongoing basis, and we need to allow this discussion to happen.
A huge cost at a human level, clearly, from everything you've just outlined. But when I look at the statistics, and I've got some in front of me, I think it costs the world economy $16 trillion. That's what they estimate.
Yes, $16 trillion now, and that cost will increase between now and 2030. And that's recognized cost. But what we need to understand is the fact that people aren't as willing to come forward because there is not a cultural norm for people to talk about mental health the same way there is that people talk about physical health. This number is probably a low number. And if we could create a culture and an environment where we can provide solutions, I think this number can come down. The economic toll can come down.
Nancy, a final question. Just run through a shopping list briefly, the simple things that companies, CEOs can do, and the rather more complex things.
Sure. I think the first thing is we need to understand that our companies are cultures, they're microcultures. And if we know that people are coming to work every day with these issues or issues for their family members, we need to create an environment where people feel comfortable coming forward to talk about these issues, where supervisors of employees are in tune to problems employees might be facing so that we can have a safe way to refer individuals to get the help that they need. We need to create conversations in our workforces, and I think the other thing that's important from an economic standpoint is issues like depression and anxiety are directly related to increases in cardiovascular events like heart attacks and stroke for individuals who have anxiety or depression, higher rates of obesity, type 2 diabetes, and use of tobacco. And conversely, individuals who have heart attacks have the same higher use of or higher incidence of depression.